from what we get to hear in other news outlets per month, the trillions that are now being shared at Federal Executive Council to states, one will expect that things should be way much better than it currently is. As I speak with you, my staff can also attest to it. Not only am I the chairman for Nigerian Medical Association Ekiti State, I'm also the coordinating chairman for all the 36 states in the federation, or for the Nigerian Medical Association. So as I speak with you now, we are currently at a point where we are about declaring a nationwide withdrawal of services of doctors.
Why?
Because federal government is still owing our members up 7 months arrears of salaries for 2 or 3 years that they promised they will pay by August 31st, and they have not paid and they didn't say anything about it. It's not just the 25-35% increment, there are also different allowances that are being owed to those cadre of doctors that have not been paid. 1. 2, based on the JAPA situation, we have been calling for an improvement in the wage structure of our of doctors, that you need to review it. The judiciary has had a review. They know what they earn now. Pengerson and health workers have had a review. They know what they earn now. So why is it impossible for medical workers to have a review of our wage structure? But lip service is being paid to that. It's as if the federal government is less concerned about whatever happens within the health sector. And the only language they do understand is when you actually have to threaten an industrial dispute with them and withdraw services. We made a press conference. The national president of our association, Professor Palamo Audu, made a press conference on the 1st of July 2025 to give a 21-day notice to the federal government on all these outstanding demands. It was almost like an 18-point demand. Up till now, barely 3 have been met, and we have waited since July 1st. Our members are tired, disillusioned, they are angry, they are bitter, they've lost confidence even in us, their representatives, that we are not arguing or speaking up for them well. And as a result, we need to take our own fate into our own hands. So you find out that the only language our governments want to understand is when we say that we will down tools. But we are sad, because when a doctor downs tools, the people are the ones that will suffer. People will not have access to a care for that period of time. Even for 10 minutes, it could have devastating effects on a family. And we do not want that. 2 minutes is too large an amount of time for you not to have access to a healthcare provider when you need one. And when we keep saying this since July 1st and nothing has been done, what else do you expect us to do? There was a committee set up to review it called the Collective Bargaining Agreement Committee. We went into the discussion with them from the 1st of September to the 15th of September. All of a sudden, everything was called off and suspended without any agreements made. And you expect us to still be happy and stay at our duty post? It can't work that way, sir. You can't expect us to still be functioning like that.
Will this proposed industrial action affect only the federal workers?
Every sphere of healthcare provision that has doctors will be affected. Federal, state, public, private, local government will be affected. Private practice will join.
What are the conditions expected to call off this industrial action?
We have demands. All we have requested is that the government meets up with outstanding negotiations that they had with us and agreements that they had with us since 2001. We have negotiations that have not yet been reviewed since 2001, 2009, 2014 with the government. Wage reviews that are outstanding for more than 25 years. And you say we are not patient or enduring enough.
But this is more about the federal government.
No, it's not just federal government. It's just that it's the federal government that determines the wage structure for the entire workers.
Okay.
So it is what is being paid as agreed by the Federal Ministry of Health that all states will adopt. Okay. So until the Federal Ministry of Health adopts it or brings out that new structure, states are not at liberty to suddenly announce it. For states that feel that their own people deserve better, they are already doing it. We have some states already, I think Akwa Ibom and 2 other states in the north are even paying more than the federal government to attract and retain their own doctors. That you guys shouldn't leave. Whatever you need, tell us, we will provide it for you.
Which means they may not declare a strike.
Well, unfortunately, if it comes to the Nigerian Medical Association and it's a general decision of the House, every member will comply. They will and they must comply.
Regardless of your situation?
Regardless of the state you are from. They will and they must comply. Because this is the soul of the profession we are talking about. And it's not a selfish thing. Doctors are leaving. Our people don't have access to doctors anymore. Whereas our politicians are busy flying all over the world to take care of themselves and their families. So where do our people fly to? Where does the woman that has a cerebrovascular incident from Ipawo or from Europura, where does she go to? Where she can't access care because she doesn't have money. Can she up and leave and go to Dubai or go to UK or go to US just like that? She can't. And the only people that can speak up for her are representatives either in the House of Assembly and everything. They are doing their best, but we can't see anything. We can't see the improvements, we can't see the changes yet. We, the healthcare workers, we are handicapped. You come to the hospital, you need these things to be done, we write these tests and investigations for you. They can't afford to pay for it. They go back to their houses and die in silence and solitude. So this is the only way we feel that we can't force the hand of government. We take care of the people, taking care of our people better, so that they can stay. There is hope when we are on ground, when we are at our duty post. There is hope, there is help, there is salvation for our people. But the moment when you go to hospitals and there are no doctors there, and we have to now start recruiting all kinds of other health workforce people to be covering our hospitals, there is a looming danger. Because you cannot substitute the work of a doctor or a dentist with any other cadre of workers. You can't. It is never done anywhere in the world, and if you try it in your society, you should be ready for the repercussions that will come.
People of the Fountain,